Hey guys, Dr. Oz here, ready to dive into a topic that's not exactly dinner table conversation, but hey, it's more interesting than your uncle's golf stories. Did you know that in almost half of all infertility cases, the male partner contributes? Yep, it's not always the ladies. So, no more blaming the dog for eating your homework. That's right, male infertility is more common than you might think. And no, it's not because you wore those tight jeans in college, although those jeans were a questionable fashion choice. It can be a tough subject to discuss, often shrouded in silence and stigma. But hey, we're all friends here, right? No judgment zone. But it's time we break the taboo and have an open conversation. No more whispering in the corner. Let's shout it from the rooftops. Well, maybe not literally. Infertility can feel isolating, but it affects millions of men worldwide. So, you're definitely not the only one. The good news? Knowledge is power. And who doesn't want to be powerful? It's like being a superhero, but without the cape. Understanding the causes, symptoms, and treatments is the first step towards finding solutions. Think of it as a treasure hunt but with fewer pirates and more doctors. In this comprehensive guide, we'll delve into the world of male infertility. Grab your explorer hat and maybe a magnifying glass for dramatic effect. We'll uncover the common causes, from lifestyle factors to medical conditions. Spoiler alert, it's not just about what you eat, although those late-night snacks might not be helping. We'll learn to recognize the symptoms and explore the various treatment options available. Because who doesn't love options? It's like a fertility buffet. Let's embark on this journey together, equip ourselves with knowledge, and break down the barriers surrounding male infertility. High fives all around, and maybe a fist bump or two. Remember, you are not alone. Seriously, there's a whole squad out there. It's like a secret society, but with less secrecy. Welcome to Health Guy's Guide, your trusted source for men's health and wellness. Whether it's boosting your energy, improving your sexual health, or enhancing your overall well-being, we've got you covered with practical tips and expert insights. Subscribe to stay informed, take charge of your health, and live your best life. Your health matters. Let's make it a priority. And remember, laughter is the best medicine. Unless you have a prescription, then maybe take that too.
So, what exactly causes male infertility? Let's dive into this mystery. It's a complex issue with a variety of contributing factors. Think of it as a detective story with many suspects. In simple terms, infertility occurs when there's a problem with the production or delivery of sperm. It's like having a pizza with no delivery guy. Let's break down the common culprits. And trust me, there are quite a few. Medical conditions. Conditions like varicocele, infections, hormonal imbalances, and genetic disorders can all impact sperm health. It's like your sperm is having a bad day. Lifestyle factors. Our daily habits play a crucial role. Yes, even that midnight snack. Smoking, excessive alcohol consumption, drug use, obesity, and even exposure to environmental toxins can damage sperm. Basically, your sperm doesn't like to party too hard. Medications. Certain medications like chemotherapy drugs and some antibiotics can temporarily or permanently affect sperm production. It's like giving your sperm a timeout. Age. While women have a biological clock, men do experience a decline in sperm quality and quantity with age. Yes, even men have a ticking clock. It's important to remember that these are just some of the common causes. The list goes on, but let's not get too carried away. If you're facing infertility, consulting a healthcare professional is crucial for proper diagnosis and personalized treatment, because even Sherlock needed Watson.
Male infertility often doesn't come with flashing neon signs saying, "Houston, we have a problem." However, there are some subtle symptoms that might give you a nudge. Keep an eye out for difficulty conceiving. This is often the most obvious sign, like trying to find a needle in a haystack. If you and your partner have been trying to conceive for over a year without success, it's time to see a doctor. No, You can't blame it on Mercury being in retrograde. Changes in sexual function. This could include problems with ejaculation, erectile dysfunction, or reduced sexual desire. Think of it as your body's way of saying, Houston, we have a situation. Pain or swelling in the testicles. This could be a sign of an underlying medical condition like varicocele or infection. It's not just a bad day at the gym. Small firm testicles. Testicular size and consistency can be indicators of sperm production issues. Size does matter, at least in this context. Remember, these symptoms are not exclusive to infertility and could be related to other health issues. So, don't jump to conclusions faster than a cat on a hot tin roof. It's vital to consult a doctor for accurate diagnosis and treatment, because Dr. Google doesn't have a medical degree.
The good news is that there are numerous treatment options available for male infertility, and no, they don't involve magic potions or fairy dust. The specific approach depends on the underlying cause and the severity of the condition. Think of it as a detective story, but with fewer trench coats and more lab coats. Let's explore some common treatment options. And no, none of them involve wearing your lucky socks. Lifestyle modifications. Simple changes like quitting smoking, reducing alcohol intake, maintaining a healthy weight, and managing stress can significantly improve sperm health. Yes, even if it means saying goodbye to your favorite pizza. Medications, hormone therapy can address hormonal imbalances, while antibiotics can treat infections affecting the reproductive system. No, you can't just Google your symptoms and self-prescribe. Surgery. Surgical procedures like varicocele repair can improve sperm count and motility. Think of it as a tune-up for your reproductive engine. Assisted reproductive technology, RT. Techniques like in vitro fertilization, IVF, and intracytoplasmic sperm injection, ICSI, offer solutions when other treatments are unsuccessful. It's like bringing out the big guns in the fertility world. It's important to remember that every individual is different and treatment plans are tailored to specific needs, because one size definitely does not fit all. Consulting a fertility specialist is crucial for determining the best course of action. And no, they won't judge you for asking a million questions. To gain further insights into male infertility, I reached out to Dr. Tamer Yalcinkaya. He is the founder of the Carolinas Fertility Institute based in Winston-Salem, North Carolina. And no, he didn't just play one on TV. Here's what Dr. Tamer Yalcinkaya had to say. Spoiler alert, it's not just about wearing tight pants. Male infertility is a complex issue, but advancements in medicine and technology have provided us with numerous treatment options. It's crucial for men to understand that seeking help is a sign of strength, not weakness. Think of it as leveling up in the game of life. Early diagnosis and treatment significantly improve the chances of successful conception. Dr. Tamer Yalcinkaya also stressed the importance of a holistic approach, incorporating lifestyle modifications alongside medical interventions for optimal results. He emphasized the need for open communication between partners and healthcare providers throughout the journey. Because let's face it, teamwork makes the dream work.
Meet Mark, a 35-year-old who faced the challenges of male infertility head-on, like a knight facing a dragon. After a year of trying to conceive naturally, Mark and his wife sought medical advice. Spoiler alert, it wasn't as fun as it sounds. He was diagnosed with low sperm count and motility. Not exactly the news you want to hear over breakfast. It was a tough pill to swallow, Mark shared, and trust me, it wasn't sugar-coated. I felt like less of a man, and the fear of not being able to start a family with the woman I love was overwhelming. Like trying to assemble IKEA furniture without the instructions. Mark underwent a combination of lifestyle changes, medication, and eventually IVF. Think of it as a fertility boot camp. After a long and emotional journey, Mark and his wife welcomed a healthy baby boy into their lives. And no, they didn't name him Miracle, but it was close. It was the happiest day of our lives, Mark beamed. And probably the loudest, too. My advice to anyone going through this is to stay positive, lean on your support system, and never give up hope. And maybe invest in some good earplugs. Mark's story is a testament to the power of perseverance and a reminder that infertility is not the end of the road. It's just a detour with a lot of unexpected turns.
Let's bust some myths about male infertility, shall we? Get ready for some myth-busting action and maybe a chuckle or two. Myth number 1. Infertility is always a woman's problem. Spoiler alert, it's not. Sorry guys, we can't blame everything on the ladies. As we've established, male factors contribute to almost half of all infertility cases. Yes guys, we're in this too. Time to share the spotlight. Myth number 2. Infertility means you can't father children. Not true, folks. You can still be a dad, just maybe not the old-fashioned way. There are numerous treatment options available, and many men facing infertility go on to have biological children. So don't lose hope and keep those baby name lists handy. Myth number 3. Wearing tight underwear or using laptops on your lap causes infertility. Really? Your fashion choices are safe for now. While these factors might temporarily affect sperm production, they are not proven causes of infertility. So, your skinny jeans are safe for now, but maybe give your boys a break once in a while. Myth number 4. Talking about infertility makes you less of a man. Seriously? Real men talk about real issues. And they do it with style. Seeking help and discussing your concerns is a sign of strength and responsibility. So, man up and speak out. It's time to separate fact from fiction and approach male infertility with accurate information and open minds. And maybe a little humor too, because laughter is the best medicine, right?
Boost your fertility practical tips for men. Let's get cracking. Here are some practical tips to improve your reproductive health. First, quit smoking. Your future kids will thank you. Smoking damages sperm DNA and reduces sperm count. Think of it as a superhero's kryptonite. Next, limit alcohol consumption. Excessive alcohol intake can lower testosterone levels and affect sperm quality. So, maybe skip that extra beer, buddy. Also, maintain a healthy weight. No, lifting the remote doesn't count as exercise. Obesity can disrupt hormone balance and impair sperm production. Eat a balanced diet. Yes, that means more veggies and less pizza. Focus on nutrient-rich foods packed with antioxidants and omega-3 fatty acids. Your swimmers will thank you. And finally, manage stress. Chronic stress can negatively impact sperm health. So, maybe try yoga or just take a chill pill. Remember, small changes can make a big difference. Rome wasn't built in a day, and neither is fertility. By adopting these healthy habits, you can take proactive steps towards improving your fertility. And who knows, you might just become a dad joke master in the process.
Your health, your future, and maybe a few less awkward family gatherings. The importance of early diagnosis and treatment. Seriously, it's not just a doctor's excuse to see you more often. Early diagnosis and treatment are crucial when it comes to male infertility. Think of it as getting a head start in the baby race. The sooner you seek help, the better your chances of addressing the underlying cause and achieving successful conception. Plus, you'll have more time to practice your dad jokes. Don't hesitate to talk to your doctor if you experience any concerning symptoms or have been trying to conceive for over a year without success. Remember, Google is not a licensed medical professional. Remember, you are your own best advocate for your health. And no, your mom doesn't count as a second opinion. By prioritizing your reproductive health, you're not just doing it for yourself, you're investing in your future and the possibility of creating the family of your dreams. And who knows, maybe even a future soccer team.
Sharing your story. You are not alone, and hey, it's cheaper than therapy. Infertility can feel like an isolating journey, but remember, you are not alone. Seriously, there's a whole club. Sharing your story can be incredibly empowering, both for yourself and others facing similar challenges. Plus, it's a great way to get free advice. We encourage you to share your experiences in the comments below. Who knows, you might even get a few likes. Your story could provide comfort, support, and hope to someone who needs it most, or at least give them a good laugh. Remember, vulnerability is a strength, and your voice matters, so speak up and maybe even crack a joke or two.
Frequently asked questions. Let's dive into the questions that keep you up at night. Question: how common is male infertility? Spoiler alert, it's more common than finding a parking spot at the mall during the holidays. Answer: male infertility is a significant contributing factor in about half of all infertility cases. Yes, you heard that right, fellas. It's not just the Wi-Fi that has connection issues. Question: when should I see a doctor about infertility? Hint: it's sooner than when you finally decide to read the IKEA instructions. Answer: if you and your partner have been trying to conceive for over a year without success, it's time to consult a healthcare professional. Don't worry, the doctor won't ask you to assemble any furniture. Question: what are the treatment options for male infertility? And no, just relax is not one of them. Answer: treatment options vary depending on the underlying cause and may include lifestyle modifications, medication, surgery, or assisted reproductive technology, ART. Think of it as a menu, but with fewer calories and more science. Question: can I still have children if I have male infertility? Spoiler alert: yes, and you won't need a magic wand. Answer: yes, many men with infertility go on to have biological children with the help of various treatment options. So, keep the baby names list handy. Question: where can I find support for male infertility? And no, your fantasy football league doesn't count. Answer: there are numerous online and offline support groups, forums, and resources available for individuals and couples facing infertility. Your healthcare provider can also connect you with relevant support networks, because sometimes it takes a village, or at least a really good group chat. Remember, knowledge is power, and seeking help is a sign of strength. By understanding male infertility, we can break down stigmas, offer support, and empower men to take control of their reproductive health. And hey, a little humor never hurts either. That will be all, folks, on this episode of Male Infertility. Thanks for tuning in to Health Guy's Guide. Your health matters. Remember to subscribe so you don't miss out. In our next video, we'll be diving into the cause and treatment of yet another common problem in the men's world. Stay tuned. And remember, if life gives you lemons, just make sure they're not the cause of your infertility. Stay healthy, folks. Before we wrap up, let's quickly recap the key takeaways from today's episode. First, male infertility is more common than you might think and can be caused by a variety of factors. Recognizing the symptoms early and seeking timely medical advice can make a significant difference. There are numerous treatment options available, and many men successfully become fathers through them. Remember, you are not alone in this journey. There are support networks and communities ready to help you navigate through it. Knowledge, support, and a positive outlook can empower you to take control of your reproductive health. Thank you once again for watching Health Guy's Guide. Don't forget to like, share, and subscribe. See you in the next episode. Stay healthy, folks.